organisation, NES, NHS Education for Scotland, we've developed now a ladder that takes us from people who are in reception can now do a course that would gain them access to a dispensing optics course. Dispensing opticians can now convert to optometry. We now have 450 optometrists have done the independent prescribing course, and now with Edinburgh University, inside the College of Medicine and Veterinary Medicine, an MSc in Primary Care Ophthalmology. We've called it that rather than Primary Care Optometry because it's really dealing with the management of eye disease at some level. And so it's how do you deal with it in the primary care sector. And the whole pressure for us in Scotland is to try and maintain stuff in the community and not refer in. So this is a 3-year course, intermittent study. You can take up to 6 years to do it if life events preclude you getting it all done in one long run. And it's all done on distance learning. We're just concluding the first year. We had 10 optometrists from Scotland last year started and 18 from around the world. The feedback is very, very positive. And what they all say is, I used to know a bit about that, but didn't really understand it. I now totally get it. And so it gives a very, very comprehensive understanding of what you're dealing with in community practice. I think the most exciting part of it is the discussion boards where the tutor will maybe ask a question, what's the nature of choroidal change that takes place in macular degeneration, let's say wet macular degeneration. So that's a nice open question, lots of things you could talk about. Somebody will say something, somebody else will comment on what they've said, then somebody else will ask a question, but what if this happens then? And then somebody else will respond. So you have 28 people all chipping in, and then periodically the tutor will say, no, well, go and have a look at this paper, and they'll cite it formally, you go and look it up and read it, and they come back to the discussion, well, all right, and I've read that paper, and now I see that this is, and so the depth of understanding they get on any topic as a result of all this chewing and bending it and breaking it and chunking it down, it just means that the depth of understanding is just phenomenal. This idea of a ladder, that the profession is continually advancing, that we're not content just to stay where we are, and that culture is starting to be embedded, so it's changing the culture, and that's really what the MSc is about, changing the way we think about academic life. And I think those who've gone through this course will just have such a thorough understanding of the nature of the disease process and the management of it, that I hope that they'll lead the rest of the profession.